I do want you to know this because this is a little plug for Arise. Arise is a group made up primarily of churches and nonprofit organizations and individuals. It's not a faith-based organization, but the churches play a prominent role in its organization. It is billed as a social justice nonprofit, and they have issues that members select to advocate for. And I know everybody's heard about the campaign to take taxes off groceries. You've heard that. That is originally and has been an Arise program. There are other programs such as pushing for the sign up of the Health Care Act. Other programs such as making the PSC do its job as a public agency and have open reviews of rates. Now, it doesn't matter to a lot of us because we're in TVA, but the PSC has been called out for not doing what it ought to do to have public hearings. And so you'll see these things in here, and I won't delay, but I do have a few we should pass around, and something free. Membership is $15 if you just get Overcome today and turn it in or mail it in, because it really is a good organization of good people. It's an unselfish organization. It's not working to promote any single thing that benefits anybody other than people who generally are on the lower income scale. It works for people who have lower incomes in Alabama. Two things. I want you to pass those around and take one if you want one. Read about Arise. There's an envelope in there. We should send us $15. It's tax deductible. Also, the free part, if you are kind enough to give us your name and address, phone, and email, we will give you important information on key issues in Alabama. There's also a great news digest that you can get via your email. And what makes it so good is not only do you get local news around the state, but they also scan the Washington Post, the New York Times, Los Angeles Times, and other papers. So I hope you sign this. I beg for you to sign it. Now, lastly, John, please sign this. We're a nonpartisan group, which means that we don't promote Democrats, we don't promote Republicans. We're so far nonpartisan. We're not partisan. But the interesting thing about it, as I told John, is I think you'll find that many of the things that we support and advocate for you would find warm, and you would find that you'd want to do it. I'm here to give a pep talk about signing up for the Health Care Act. And I want to tell you, I've done three of these, and every now and then there's somebody that's angry in the audience because they don't understand all of it, or they have questions about it. And I'm not really here to answer a lot of questions. I'm here to try to make it relevant to you in some way. And I want to make it relevant this way. Obamacare, if you want to call it that, or the Affordable Care Act, is the law. I don't care if you like the president or dislike the president. I don't care what you think. What I do care is that people should sign up for it and take advantage of what it offers. Okay, we've got a couple of problems with that, but I want to talk about DeKalb County very quickly. The poverty rate in DeKalb County is about 21%. I want you to think about that. We can look around the room, and 1 out of every 5 persons in this room may be a statistic in the poverty rolls. 21%. Now, what the Affordable Care Act is aiming is that those people in poverty up to 400% of poverty. And Baby, I know you got those sheets on the poverty scale.
Yes, I do.
And she's going to pass those out. And I'll introduce her. Well, I can't introduce everybody. I'm not in charge. This is Baby Smith. She's a certified application counselor for the health care plan. And she's going to be important. As I walk out the door, she's going to be more important. We have 2 navigators here that are part of the Progressive Women of North Alabama and the Democrat Club, Jan Newhoff and Margaret Baker. And they're going to be taking over after I leave. We all get to eat and ask more questions. Now, the reason it's important is DeKalb County, the state of Alabama, is pulling up the rear end in economic development in the country. So when you see an ad that says, oh, we got lots of jobs, it's not true. So if anybody tells you we're doing great, you can say whatever you want to say. But you can say 1 out of 5 of my neighbors are in poverty. Over half the children in DeKalb County get free and assisted lunches. That means that they fit into a poverty range. We're not doing very good. So one of the things that we might do that might improve our well-being in this county and across the state. And that is to encourage every person to sign up or to apply for the health care plan. Now let me tell you who the health care plan is for. It's for people who are uninsured or underinsured. And underinsured means those people who have a lousy insurance plan. And let me tell you, they're out there. I've got a son that had one. He didn't pay much for it. He didn't get much for it. The way Blue Cross Blue Shield is, they're a monopoly. They've got about 88% of the business. They're going to determine the market because there's no competition in Alabama. I looked up Connecticut the other day. I believe they had 9 separate companies competing in that private market, which, incidentally, in case somebody walks up to you at church and says, you know, I'm against this socialization. Well, look, it's a private insurance market. It's a private program. It would be better if it were like Medicare, but it's not. It's a private program, and the insurance company is going to control those costs to some degree. Now, what's important? I've got my worksheet here. There's another important thing, and I'm going to try to call it hard to do without putting it up, but I'm going to tell you this. In those sheets, Dandy passed out those sheets. What it tells you, if you look at it, these are the standards in Alabama of who could get discounts under the Affordable Care Act. And what it tells you, if there's one in the family, and your income's $11,490, that low, then you're going to get a great bargain in insurance in the United States and in Alabama. And as you look down that family size, that tells you the markers of who will qualify at the poverty level. And you can see on here that you can go all the way to 400%. In fact, it tells us that if we've got a family of 4, the income could go as high as $94,000 and some discount would be there. Now, it's income weighted. And everybody, I hope you know what that means. That means the less income you make, the more help you're going to get from the program. And I think that's a good thing. It's meant to be that way. Now, here's the other sad part, where everybody's got to go home tomorrow and pick up the phone and make a call. As you know, the governor of Alabama has said that he will not agree to participate in the expansion of Medicaid. Expansion of Medicaid for the folks up to $11,400 in number 1. You go down to 4, let's talk about that. You have 4 people in the family, poverty's $23,550. If you've got 4 people in your family, and you got 2 people working or 1.5 person working, you got the husband working at Wendy's, and the wife staying home with the kids and trying to take care of them, they will not get any assistance for their health insurance. And that's because the governor will not expand Medicaid. The only thing you can do as a person, if you care about the people around you, is to go call the governor's office. Now, some of you called the governor's office before. And if you haven't, let me tell you, I don't have the number. Somebody's going to have it. You call them, the secretary's going to answer the phone. The secretary's going to say, what can I do for you? And you can say anything you want to say. This is what I say. Hello, I just want you to know that I'm encouraging the governor in the strongest terms to expand Medicaid. Because can you imagine filling out an application as Margaret's done and Jan's done and Bam's assisted, and you have somebody that they're working hard every day to try to make it in a county like DeKalb where there's not many jobs and poverty's 20-something%. And guess what? They come in at $10,000 and you have to say, well, I'm sorry, if you made $1,000 more, you would get insurance at $20 a month. But since you make less than that number, if you get insurance, you got to pay $500 a month. It's insane. Now let me say one thing more. It's okay to call the governor's office. It's okay to be strong with them. But the only way that we're going to have a chance to help everybody in Alabama is for you to take that one challenge, is to call. Now, our role, as I said, we're nonpartisan. Our role and our mission is to help people in poverty and low income. So that's what we do. We encourage people, just in meetings like this, at the next meeting I go to, and all over the state, we're going out and outreach and asking people to sign up for the health care plan. It's not necessarily easy. It's not near as complicated as you've been led to believe. If you watch Fox News, you might have a question or two. I had one night before last, and that is, I'm not for this because illegal immigrants get this free. That's not true. Navigators, who are they? They're just your neighbors, but they don't check them out. That's not true. And it's not secure. It's not true. If you've gone online and done anything in the modern world, your numbers are out there somewhere. They're out there somewhere. So that's my role, is to encourage you to talk to each other, to understand the program as we get talking about it a little bit more, and to tell people how important this is. And there's not a county in the state outside of the Black Belt that this program means more for than the people right here in DeKalb County. So, and I don't know how much time I got. You want me to keep preaching?
Until you have to leave.
I've got about 10 more minutes.
Are they getting hungry?
These navigators that I've called out, the counselor can do a lot better job explaining specifics of the law. And because of that, I'm going to turn it around and say, what are some of the concerns that you have? Have you heard things? Are you concerned about it? What have you heard? How many people watch Fox News?
Not me.
I watch it every morning. That's where I get my propaganda.
No, follow up on your statement about Blue Cross having a monopoly. We could point out that they have to spend 80% of their premiums on the cost of treatment.
Because of this act.
Yeah,
Right.
so if they are ballooning their premiums, you'll get a refund in the mail.
That's true.
Thanks to Obama.
Right. The Healthcare Act has got a lot of accountability in it. It's got accountability for hospitals. It has accountability on how insurance companies run their programs. And that's absolutely true. There's been a lot of discussion about why these insurance rates have gone up so far. Blue Cross Blue Shield says they've gone up to cover all of the new things that you get as being a part of an insurance policy, whether you're under the Healthcare Act or whether you're buying insurance independently. Now, and I passed out a few of these, and this kind of catches. If I had the projector, this is what you'd see. And I'm just going to call because we don't have a lot to call it out. They're essentials in the healthcare program. On this pink sheet, if you need some, I've got them. And I can read them. I can tell you this. There are basics in this, like getting service with an ambulance. Have you ever known anybody that was sick, so sick they couldn't drive, and they said, well, I got to drive because I can't afford to pay for an ambulance? Well, now these things are covered. There are great benefits for, and I laugh about this. You go look at the list of free benefits for women. It's about this long. Then you get over to children, it's about this long. And then for men, it's about here. But that doesn't bother me because women use medical services more than men. And we understand that. But there's so many preventative things that are covered free under this. So that's what part of the impetus on this bill is to keep people from getting sick by providing immunizations for children, providing dental care for children up to 6, providing the things that they don't normally have because they can't afford it. So, I guess I've been through a journey on this. I've started saying, well, I'm really worried about this. And I got to saying to myself, well, if we're going to be good people, and if we're going to believe what we read in the Bible and what we hear at church, then we got to start caring about people that don't have the same advantages we do. Now, I love to tell this because it's true, and if you're from DeKalb County, you know it's true. My parents grew up in Salt Mills. They didn't make any money. They didn't have any advantages. It was tough. There were decisions that made hurt family. Well, that's what this thing helps to do. There are those families who work hard and need a break, and that's what this does. Now, I could go on and on. I could go on forever. On the yellow sheet, what this is for is to talks about the marketplace. The marketplace is where you go online and you try to find out what your premiums would be without discounts, and that's what the marketplace is. It's got the numbers on here that you need. It's got the website that you can go to, and then on the back, if you know people who need to enroll, it has a list of the things that you need to have with you to be able to make your application. One of the things that we advise everybody to do, and that is apply. Now, you're gonna walk into somebody here. Somebody's gonna say, well, I'm not gonna apply. I don't make enough money. You gotta go apply. You're gonna have somebody that says, well, I got a dependent in the house that gets Social Security. I'm not gonna apply. Well, you have to apply because there are different things that affect who can receive discounts. Yes, ma'am.
I'd like to ask a question, because you brought that up about Medicare. My husband's 71, and I'm 62. So when I went to apply on the online, I put both of us need insurance, and he just needs the supplement. You know, that's all he needs, but I need insurance. And so it didn't work out right for some reason. Am I doing it wrong?
Yeah. I think your navigators will tell you what you have to do is you need to apply for yourself. Now the best information I've got, and again, these folks are more knowledgeable than I am about the details, but if you're on Medicare, you've got about the best plan. So your husband's got about the best plan. And I'm on Medicare. I'll tell you something, that's a great program. And I'm glad to get it. It's so good, I almost feel guilty. John, are you old enough to be on Medicare? I didn't think, I know John and I might be old enough, but nobody else is. So, I want to tell you a story.
Jan has a handout on that,
Interrupt anytime.
Can I answer Kay's
Yes.
question?
Yes.
If you're on Medicare, you don't need to apply for insurance for yourself.
Right.
You don't get your supplemental insurance through the marketplace. Medicare.gov has its own. However, if you have a spouse who is not on Medicare, then you apply as a couple so that you use both of your incomes, assuming that you pay your taxes on the same income tax form. And you use both of your incomes and you say, this is our household, but I am only applying for coverage for this person.
And then again, these folks are going to be able to tell you all those things much better than I am. I'm a cheerleader. Oh, yes, ma'am.
I wanted to ask you about a rumor.
Well, good.
love it.
Strictly rumors, but I had someone tell me today that he and his wife's premiums went down on their insurance that they have right now. And that he had heard that the governor was letting the insurance companies have the subsidies instead of passing them on to the
Well, that's a reverse rumor, maybe we like that.
Yeah, that's a good one. But no, the way the program's set up, and just briefly, it's set up that you go put in your income information and determine what your discount is if you're eligible for one. If you're eligible for one, you get a subsidy, you get a tax credit that goes straight to the insurance company. Now, there's a way to get around that, ma'am.
It does go to the insurance.
Yes,
does,
because
yeah.
that's the way that the money's being transferred, that's a subsidy. It does go to the insurance, the plan you have, which here is gonna be Blue Cross Blue Shields.
Right.
What if your income varies from year to year?
It's,
That's it.
under the law,
Self-employed.
under the law changes, you can go in, these are experience, or things that happen that, like that, your income changes, there's a tragedy in the family, someone dies, you get married, you get divorced. There are things in the law that allow for those circumstances to be taken care of at the time.
But I do realize there are some workmen and work women that have the type of jobs that their income might vary from month to month or year to year because they take on an additional carpenter's job or additional.
Self-employed contractors, for
Yes,
instance.
exactly.
Well, it's tied into the IRS, and that's why you gotta do income figures.
You do an annual.
So you're not gonna be doing a monthly income thing to determine your premium, you're gonna do just like Medicare. There's gonna be an enrollment period, and you enroll, and then next year there'll be another enrollment period. So that's the way it's gonna work generally.
Can I just
Sure.
say one thing on
Say
that?
anything you want to.
If your income, if you estimate your income, say, is going to be $50,000, because that's pretty much what you made as a self-employed person this year, and it turns out that you're having a really good year, as soon as you realize that you're gonna be going over that, you call HHS, you call the healthcare hotline, and you tell them, I need to change the amount of income I estimated. The same thing if it goes down. And you need to do that as you go along the year so that you don't get caught at income tax time with a much bigger income than you estimated and owing them money.
If you get some back because you made less income, that's okay.
I want to tell you a story about what happened in Gunnersville, and this is why it's worth it to do. You know, it's relatively hostile. 2 or 3 folks were hostile. And, you know, if you've ever, Jimmy's been in politics. We got folks in politics here. You get hostile people every now and then. But I kept watching one couple in the back, and there's one guy, and I kept looking. I said, I'm not interested in your personal income information. But I'll just tell you what these parameters are. And so I kept watching the guy. And finally the meeting was over. It's supposed to last 2 hours, and a half because people kept asking questions. And so he came up and I said, well, can I help you? And he said, well, let me tell you my story. He said, I've got a young son. We're paying $200 a month on insurance. I've got a 19-year-old that's coming off of Medicaid. My wife, we don't have any insurance. And he said, I had to go to the hospital this year, and I had to spend $50,000. Well, he didn't have $50,000. He charged up $50,000. So in a way, a person like that making the income he made, I guess that would be a life changer. I guess it would ruin your life. It wouldn't mind in a circumstance like that. And so I told him, without going back in the computer, on his income, approximately what his premium would be. And there'd be approximately $200 a month. What he was having to pay for one child, under this program, he's going to be able to insure his family. There's caps on it so that if he had been in the same circumstance, his cost would have been more like $6,500 for a catastrophic problem. But that would have been catastrophic for me at $50,000. So he took these papers here, 4 or 5 of them. He said, I want to take those with me because people I work with don't have health insurance. And that made my night. All the abuse was worth it to get one person knowing that his family's going to get health care and he's going to promote that among people that he works with. Folks, in our area, there are tons of people out there that need and deserve coverage. When you go to church, don't be afraid to say, you know, I've been thinking about this. And my obligation is to try to help my neighbors. And I'm going to encourage everybody I can to go online, to call these navigators, to call these certified assistants. And there's a list of them on the website where it says get local help. And there's probably 25, 50 in DeKalb County or surrounding areas where you can get help. So our mission is to try to help our society, is try to help the people around us to sign up. And so I hate to be brief and have to be preachy, and I hate to say I don't know all the facts, but I do know this fact. If we will go sign people up, it will create I've just told Big Phil. If we call the governor's office and we create as much havoc as we can to expand Medicare, we will create between 20,000 to 30,000 new jobs in Alabama. I just saw the other day he's going to give one company, I don't know, $200 or $300 million to create 1,000 jobs. If you expand Medicare, you bring in $11 billion of federal money through about 2018, 2020, something like that. The tax revenue created by the job creation coming from that will bring out $1 billion in taxes. The cost to expand Medicaid in Alabama is estimated to be $500, $600 million. You know, what, as they say, what's $100 million here or there? But the point being is the economic development from participating in this will create more jobs than anything that you can imagine for the money. It will create a basis of wellness and health care for people who don't have it. It will make all of our communities better. It will make certainly a better environment for all of our children. So that's my speech. But Medicaid must be expanded, and you're the person that can do it. And somebody, John, can tell you how to call the governor's office a lot better than I can. Call them up and tell them they've got to do it. And that's
It's in the newspaper, right, guys? I see it in the newspaper, the governor's
well, he calls the job numbers phony, and he says this and he says that, and that's fine. But if we don't participate, there's $11 billion that's going somewhere. Where's it gonna go? It's gonna go to Ohio, it's gonna go to Connecticut, where's it gonna go? But it doesn't come to some of the poorest people in the whole country if he doesn't expand. So the cost is minimal, the benefits are enormous, economic development's enormous, but the whole personal things that's gonna occur will be significant in all of our lives, all of our lives. And of course, well, I've said enough. I didn't have a lot of time anyway.
Thank you.
Thank you. I'm gonna leave a few of these. I will say, if you look on that Arise brochure, if there are groups of people that you need, well, we do, actually, I don't do cheerleading on the other program. We actually show slides and talk about all the program. But if you need people to come, there are people at Arise that are traveling the state every day trying to get people to do what? To follow the law. It's not a matter of who you hate or who you like. It's not a matter of anything. The law's passed. The benefits are there. Let's help our community. Thank you very much. I
Thanks.
appreciate it. Thank you. Thank you. Again, these people know a lot about it. So.
Well, we're learning more every day. I imagine you would like to probably start eating. It's getting that time of day. Jan and I will have information share, and we will, welcome your questions, and we will answer them as we can. And I do have to say that she and I are a bit overwhelmed because we have found out that we're the only two navigators in DeKalb County. And the navigator is needed at some point by a lot of people to do a lot. So we are recruiting navigators. And we are also recruiting, if you know, any of you know, a building, a space that might, a business person who might have an extra office, it would be so great if we had some place to work from. We have a lot of volunteers that would help us, but we, for now, will be, working out of our homes or together in our homes or going out into the community and making presentations, and having enrollment events. But if any of you know of a good place that you might ask a friend, let these two ladies come in and kind of have a sense of place to be, not disruptive, but to even just have a spot where we know we can go to. Okay, enjoy, and I believe we'll serve ourselves. And that drink, okay, the drinks are over here. And those of you that aren't eating, we will start talking before you have to finish eating. So you can serve yourself though and go ahead and start.
I'm Jan Newhoff. I'm a volunteer navigator. I am a navigator because we don't have any paid navigators or any, other than Margaret and me, any other volunteer navigators in DeKalb County. We are going to be setting up sessions at some of the places like libraries. We have 2 sessions set up right now. One is on Monday, December the 9th from 12 to 4 at the Fort Payne Library, and the other is on December the 10th from 12 to 4 at the Rainsville Library. We'll be setting up more opportunities for people to sign up. You can also ask the librarians if they would get in touch with us if there's someone who misses those times. We'll be asking the paper to advertise those opportunities. In order to be covered for health insurance by January 1st, you have to sign up before December 23rd. So we will be working very hard between now and then.
I'm Margaret Baker, and as Jan said, we are ready to get going. We feel like the people in DeKalb County all deserve the opportunity to have health care, and we are passionate about helping them to get enrolled for affordable care. It will be beneficial to individuals, beneficial to our economy, beneficial to the other things that happens within our community and our county and our state. So please, feel free to come. We'll answer all your questions. We'll try to make sure you understand what we have to tell you. And we will see if you're eligible to be one of the persons in the country to receive health care. Thank you.